Hello everyone. In continuation of important topic series for UPSC CMS 2025, I will tell you important topics of obstetrics in this video. Earlier I have made video of the important topic of surgery, pediatrics, gynae and PSM. You can see these video from the link given in description box. I have made these important topic list after analyzing last 24-year question paper of UPSC CMS. So you can mark these important topic in textbook with particular color and revise it before the exam. These topic will be the most helpful for the student who are in final year or third year because they are already studying textbook in third year or final year. So by completing these topic along with it, their preparation of CMS will also be done easily. Only you will have to solve previous year question extra. For this you can take Prashad guide. When you solve previous year question after completing these topic, those questions will seem very easy to you. In Prashad guide, last 24-year question with detailed explanation is given. Here is explanation is taken from latest edition of standard textbook and reference with page number is also given. To understand the pattern of question in CMS and its relation to textbook, you must have to do previous year questions. Now how to use Prashad guide? Here is a question asked regarding a hydrative for mole. Here author has given answer with explanation with reference of textbook. You can go to that page number of textbook and mark it. In this way you can save your time and efforts. Here the reference of Datta textbook of Ops 10th edition page number 183 is given. You can go to that page of the textbook and mark it and read before the exam. In obstetrics, chances of repeat is less as compared to PSM because topics in Ops are lengthy. You have to take 10th edition of Datta's textbook of obstetrics. Here few topics and tables are changed from previous 9th edition. Contraception chapter is very important. You have to do it from the textbook because there is always repeat from this chapter. Anatomy of female reproductive organ. Female organ homologous to male organ. Anatomy and attachment of uterus. Fundamentals of reproduction. Oogenesis and spermatogenesis. Implantation timing. Important event following fertilization is the table. Tissue and organ of origin from ectodermal, mesodermal and endodermal layer. Placenta and fetal membrane. Placenta पूरा topic important है. Placental hormone, amniotic fluid पूरा chapter important है. Umbilical cord का blood supply. The fetus, इसमें changes in fetal circulation at birth. Physiological changes during pregnancy, whole chapter important है. Uterus, weight changes in different ages, contraction, Braxton Hicks contraction, weight gain, body water metabolism, सारे table पढ़ने आपको. Hematological changes, cardiovascular changes, metabolic changes, systemic changes. All table in this chapter is important, but apart from the table, question usually asked from the theory portion of the chapter. In endocrinology, maturation of Graafian follicle and ovulation, hormone responsible for maintenance of corpus luteum, placental hormone, protein and steroid hormone, endocrine control of lactation. In diagnosis of pregnancy, first trimester में uterine and cervical sign, condition of false positive HCG level, causes of positive pregnancy test without pregnancy, gestational age and embryonic structure identified by transvaginal sonography, इसका table. Second trimester quickening, third trimester में fundal height, sonography, differential diagnosis of pregnancy, chronological appearance of symptom and sign in pregnancy, sign of previous childbirth, estimation of gestational age, estimation of fetal weight. In fetus in utero, preponderance of lie, presentation and presenting part is the table. Condition where the height of uterus is more than the period of amenorrhea. Condition where head failed to engage in the primary gravida after 38 weeks. In fetal skull and maternal pelvis, all diameter of fetal skull, circumference of head in different attitude, difference between caput succedaneum and cephalohematoma, true and false pelvic inlet, diagonal, obstetrics and true conjugate, transverse diameter, obstetric significance of plane of least pelvic dimension is the table. In antenatal care, pregnancy dating by USG, टर्मिनोलॉजी बाय लाइक नलीपेरा, नलीग्रेविडा एक्सेट्रा इसका टेबल. टेटनस इम्यूनाइजेशन, डाइटरी रिक्वायरमेंट इन प्रेगनेंसी, सप्लीमेंटल आयरन, minor ailment in pregnancy, contraindication of exercise and to limit physical activity इसका टेबल. Vaccine in pregnancy, indication and contraindication, recommendation of weight gain during pregnancy इसका टेबल. एंटीनेटल असेसमेंट एंड फीटल वेलबींग में एंटीपार्टम फीटल सर्विलेंस होल टॉपिक इंपॉर्टेंट है. मैनिंग स्कोर इसका टेबल पढ़ना है. एंटीनेटल डॉपलर यूएसजी चेंजेस एंड सजेस्टिव फीचर ऑफ कंप्रोमाइज फीटस इसका टेबल. असेसमेंट ऑफ फीटल लंग मैच्योरिटी, फीटल मैच्योरिटी टेस्ट इसका टेबल. प्रीनेटल जेनेटिक काउंसलिंग में रिस्क फैक्टर फॉर प्रीनेटल जेनेटिक स्क्रीनिंग इसका टेबल. प्रीनेटल जेनेटिक स्क्रीनिंग, प्रीनेटल डायग्नोसिस, बायोकेमिकल एंड बायोफिजिकल स्क्रीनिंग टेस्ट इसका टेबल. कोरियोनिक विलस सैंपलिंग, amniocentesis, cardocentesis, USG finding in fetal aneuploidy screening. In normal labor, criteria for normal labor, causes of onset of labor, true and false labor pain, stages of labor, bag of water, lightning, feature of ripe cervix, uterine contraction in labor, effacement of cervix, second and third stage of labor, timing and pressure, suppression of membrane and expulsion of placenta, mechanism of normal labor, whole topic and its sequences, clinical course of first, second and third stage of labor, bearing down effort, partograph, evidence of maternal distress in first stage of labor, care following delivery of fetal head, immediate care of newborn following delivery, early and late clamping of cord, active management of third stage and its advantage, assisted delivery of placenta, expected management of third stage, intrapartum care of positive child birth experienced by WHO इसका टेबल. In normal puerperium, involution of uterus, anatomical consideration and clinical assessment, lochia, general physiological changes, ये whole topic important है. Composition of colostrum and milk, drug improving milk production and suppression, management of ailment after pain and postpartum exercises, exclusive breastfeeding and reduction of infant morbidity and mortality इसका टेबल. In nausea and vomiting, causes of vomiting, hyperemesis gravidarum की definition, risk factor, complication and management. Hemorrhage in early pregnancy में definition and DD of all kind of miscarriage and abortion, इससे clinical question पूछे जाते हैं. Spontaneous abortion का incidence, etiology and common cause, threatened abortion का feature and investigation, inevitable abortion का feature and management, complete miscarriage का feature, incomplete abortion का feature and investigation, missed abortion का feature, ultrasound and pathology, septic abortion में clinical feature, investigation, complication and management, indication of ICU management, recurrent abortion first trimester and second trimester both दोनों के causes, cervical incompetence, management of cervical incompetence and contraindication of cerclage operation and complications. MTP whole topic important है including complications. Ectopic pregnancy में risk factor का table, site of implantation का flow chart, tubal pregnancy में etiology and changes in uterus, secondary abdominal pregnancy and its fate इसका table, clinical feature and management of ectopic pregnancy, medical and surgical both, contraindication of methotrexate therapy, abdominal and ovarian pregnancy whole topic important है. Gestational trophoblastic disease का classification, hereditary form mole ये पूरा chapter important है. Difference between complete and partial mole, persistent gestational trophoblastic neoplasia का diagnosis and treatment, multiple pregnancy and amniotic fluid disorder में twins whole chapter important है. Polyhydramnios का clinical type, etiology, sonographic finding, DD and complications, oligohydramnios का definition, etiology and complications. Placenta subsaturata, extracorales, membranaceous, bilobate इन सबका definition, cord abnormality, petal door and filamentous placenta, single umbilical artery. हाइपरटेंसिव डिसऑर्डर इन प्रेगनेंसी में क्लासिफिकेशन ऑफ हाइपरटेंशन इन प्रेगनेंसी इसका टेबल, कॉमन कॉजेज ऑफ क्रोनिक हाइपरटेंशन इसका टेबल, क्राइटेरिया ऑफ डायग्नोसिस ऑफ सुपर इम्पोज प्रीक्लैम्सिया एंड एक्लैम्सिया इन केस ऑफ क्रोनिक हाइपरटेंशन इसका टेबल, प्री-एक्लैम्सिया का डायग्नोस्टिक क्राइटेरिया, हेल्प सिंड्रोम, posterior reversible encephalopathy syndrome is the sign and symptom, investigation and complication, risk factor and etiopathogenesis of preeclampsia is the table, indication of aspirin therapy in pregnancy is the table, management of preeclampsia, coccygestosis score, organ dysfunction in preeclampsia and eclampsia. Criteria for gestational hypertension, acute fulminant preeclampsia, monitoring of patient with severe preeclampsia on magnesium sulfate and indication of delivery without delay is the table. Eclampsia में definition, causes of convulsion, clinical stages and DD. Maternal complication and regime of magnesium sulfate is the table. Medical management of eclampsia, magnesium sulfate toxicity with serum level and detection of magnesium sulfate toxicity is the table. Management of magnesium sulfate toxicity, indication of intubation in eclampsia and differential feature of eclampsia, gestational hypertension and essential hypertension. In antepartum hemorrhage, causes of APH, placenta previa का risk factor इसका table, type, degree, stall-worthy sign, complication इन सब का table, management difference between placenta previa and abruptio placentae इसका table, placenta accreta का etiology, pathology and management, abruptio placenta का variety and clinical question asked from differential diagnosis, etiology, clinical manifestation of hemorrhage, pathogenesis, covariate uterus, clinical classification and prognosis, clinical feature of revealed, mixed and concealed variety, the complications. In medical and surgical illness complicated pregnancy, इसमें normal blood value in pregnant and non-pregnant women इसका table, factor responsible for anemia, iron deficiency anemia में whole topic including treatment option at different intrapartum period, megaloblastic anemia, aplastic anemia, heart disease in pregnancy, anatomical and physiological changes during pregnancy which mimic cardiac disease, risk of maternal mortality with the heart disease and functional classification of the heart disease and risk factor for cardiac failure. Gynecological disorder in pregnancy में CA service में management during delivery, retroverted gravid uterus and management of prolapse in pregnancy. In preterm labor, premature rupture of membrane, prolonged pregnancy and intrauterine fetal death में preterm labor, इसमें आपको definition, classification, etiology, including risk factor, corticosteroid therapy, preterm labor and management ये सारा चीज पढ़ना है. Preterm rupture of membrane में definition, disorder associated with the prompt diagnostic test for chorioamnionitis, इसका management. Postpartum pregnancy में classification, etiology and complication, intrauterine fetal death में causes, pathology, management and indication of placental histological examination, ये सारी चीजें आपको पढ़नी है. Complicated pregnancy, risk factor for scar rupture, trial of labor after cesarean, contraindication and indication of cesarean section, red cell alloimmunization, इसका whole topic, prevention of RSD alloimmunization, hydrops fetalis, indication of anti-D immunoglobulin, causes of feto-maternal hemorrhage, alloimmunization, elderly primary gravida का complications, grand multipara के complication, bad obesity के clinical feature and lab criteria for diagnosis of antiphospholipid syndrome. In contracted pelvis, variation of the female pelvis, anatomical feature and obstetric outcome of parent pelvic type इसका table, cephalopelvic disproportion, trial of labor में indication and contraindication, advantage and disadvantage, unfavorable feature. Abnormal uterine contraction में uterine inertia, cervical dystocia, precipitated labor, Bandal's ring and pathological retraction ring इसका table, deep transfer arrest, breech presentation में etiology, difference between complete and frank breech इसका table, complication of vaginal breech delivery, external cephalic version and internal podilic version is whole topic important है, assisted breech delivery, face presentation में etiology, presenting part and mechanism of labor, transverse line में etiology and maneuver, shoulder presentation, cord prolapse में etiology, diagnosis and management. Prolonged labor में definition and causes of prolonged labor, danger of prolonged labor, obstructed labor में cause, effect on mother and fetus, रिस्क फैक्टर ऑफ मैक्रोसोमिया, शोल्डर डिस्टोसिया होल टॉपिक इंपॉर्टेंट है। न्यूरल ट्यूब डिफेक्ट में एनेंसेफेली इंपॉर्टेंट है। कॉम्प्लिकेशन ऑफ थर्ड स्टेज में पीपीएच प्राइमरी एंड सेकेंडरी होल टॉपिक इंपॉर्टेंट है। रिटेन प्लासेंटा में डेफिनेशन, डेंजर्स, प्लासेंटा एक्वीटा स्पेक्ट्रम में रिस्क फैक्टर एंड डायग्नोसिस, इन्वर्जन ऑफ यूट्रस में डेफिनेशन, डिग्री, इटियोलॉजी, डेंजर एंड मैनेजमेंट। इंजरी टू बर्थ कैनाल में रिस्क फैक्टर फॉर थर्ड डिग्री पेरिनियल टियर, इसका टेबल। क्लासिफिकेशन ऑफ ऑब्स्टेट्रिक एनल स्फिंक्टर इंजरी, इसका टेबल। सर्वाइकल टियर में कॉजेज एंड कॉम्प्लिकेशंस, रैप्चर ऑफ यूट्रस में इटियोलॉजी, डायग्नोसिस एंड मैनेजमेंट। एब्नॉर्मलिटी ऑफ पुर्पेरियम में पुर्पेरल सेप्सिस में प्रीडिस्पोजिंग फैक्टर, माइक्रो ऑर्गेनिज्म रिस्पॉन्सिबल, क्लिनिकल फीचर, स्प्रेड ऑफ इन्फेक्शन, इन्वेस्टिगेशन एंड ट्रीटमेंट। पुर्पेरल पायरेक्सिया में डेफिनेशन एंड कॉजेज, सब इन्वोल्यूशन होल टॉपिक इंपॉर्टेंट है। यूटीआई में ट्रीटमेंट, फिजियोलॉजिकल चेंजेस रिस्पॉन्सिबल फॉर इट, एक्यूट मास्टाइटिस, क्रैक्ड निप्पल, कोरिया एमनियोनाइटिस में एटियोलॉजी, डायग्नोसिस एंड कॉम्प्लिकेशंस। न्यूबॉर्न इन्फेंट में इन्फेंट फीडिंग, रिस्क ऑफ लॉन्ग टर्म आर्टिफिशियल फीडिंग, एडवांटेज एंड प्रिपरेशन ऑफ ब्रेस्ट फीडिंग, कंगारू मदर केयर, कंट्राइंडिकेशन ऑफ ब्रेस्ट फीडिंग, ड्रग एंड ब्रेस्ट फीडिंग, कंपोजिशन ऑफ ह्यूमन एंड काउ मिल्क, लो बर्थ वेट बेबी में फीटल ग्रोथ क्लासिफिकेशन, प्रीटर्म बेबी में डेफिनेशन, इटियोलॉजी एंड कॉम्प्लिकेशन, कॉम्प्लिकेशन ऑफ लो बर्थ इन्फेंट एंड इट्स मैनेजमेंट, fetal growth restriction या IUGR, feature of early onset and late onset growth restriction, definition of fetal growth restriction, etiology, diagnosis, complication and management. Disease of fetal and newborn में causes of respiratory distress, hyaline membrane disease, transient tachypnea of newborn whole topic important है, hemolytic disease of newborn, cephal hematoma, etiology, non-immune hydrops, Pharmacotherapeutics in obstetrics में ऑक्सीटोसिन, इंडिकेशन, साइड इफेक्ट एंड कॉन्ट्राइंडिकेशन, प्रोस्टाग्लैंडिन्स, एंटी हाइपरटेंसिव सेफ इन प्रेगनेंसी, टोकोलिटिक एजेंट, टेराटोजेनिक ड्रग्स, एपिड्यूरल एनाल्जेसिया, इसका टेबल, साइड इफेक्ट ऑफ स्पाइनल एनेस्थीसिया, पोस्ट ड्यूरल हेडेक का टेबल। इंडक्शन ऑफ लेबर में होल चैप्टर इंपॉर्टेंट है। पॉपुलेशन डायनेमिक्स एंड कंट्रोल ऑफ कंसेप्शन में होल चैप्टर इंपॉर्टेंट है। ऑपरेटिव ऑब्स्टेट्रिक्स में एपिजियोटमी, फॉरसेप्स होल चैप्टर इंपॉर्टेंट है। वेंट्यूज होल चैप्टर इंपॉर्टेंट है। वर्जन एक्सटर्नल एंड इंटरनल होल टॉपिक इंपॉर्टेंट है। सिजेरियन सेक्शन होल टॉपिक इंपॉर्टेंट है। करेंट टॉपिक्स इन ऑब्स्टेट्रिक्स में प्रेगनेंसी फॉलोइंग असिस्टेड रिप्रोडक्टिव टेक्नोलॉजी, मैटरनल एंड फीटल कॉम्प्लिकेशंस। Imagine in obstetrics में ultrasound and MRI. Thank you for watching this video.